Hey guys, my name's Jordan. Welcome to my YouTube channel. I'm going to start talking about infertility. That's what I'm going through right at this very moment. This is my first video, so bear with me. I'm a little nervous. I know that the quality isn't going to be the greatest, that we're probably going to have some hiccups here and there, but we'll get through it. So I'm going to start with talking about my IUD. I did have my IUD for about 4.5, almost 5 years, and I got that taken out in November of 2016. So before that, I had been on birth control. I had tried the pills. I had tried the depot shot, and then I went on to the Mirena. I didn't like taking pills. I don't take pills very well. I don't take them on time. Like you're supposed to, at least. I didn't like the depot shot. I gained a lot of weight within a short period of time, and then I went on to the IUD, and I really enjoyed that. But I got that taken out in November 2016. Ever since then, me and my husband have been trying to conceive and have a baby. I had started having irregular periods, and I had, like I said, always been on birth control, so I didn't really know if it was normal or not. But of course, anytime you think something's wrong, your mind just starts wondering, like, is it me? Is it him? What's going on? So we went ahead and went into the doctor. That was in September of 2017. We started trying to go to the doctor and, ask her, well, what's going on? Can you do some tests? I think I'm having irregular periods. Can you, give me some information about that? Well, I kind of felt like she was brushing me off. She wasn't really listening. So, I don't know. I just felt like she wasn't hearing my concerns, I guess. Because I felt like there was something wrong. But she wasn't seeing where I guess I was coming from. I don't know. Regardless, she told me that I wasn't having irregular periods. She told me, let's just wait it out. If you really feel like this is an issue, like you don't want to wait or whatnot, let's put you back on the pill and we'll get you regular again, and then we'll go from there. And I wasn't really excited about that idea, so I just waited a couple months. I waited till December, and I spoke with my husband. I was like, I don't feel like I like what she's doing for us. I don't feel like she's handling my situation the way that I'd like it to be handled. I'm not really comfortable with it, so let's see if we can go with someone else. So I ended up finding a new OB, and I really love him. And if you are from the Oklahoma area, then like this video and comment down below, and I can tell you all the great things about him. But I did find an OB. He got me in right away, which was great. When I did end up going in, he asked me about my history, got to talk about that, and he ended up doing a pelvic exam. And then he also asked me, okay, well, do you know what days are best for your ovulation? And I was like, well, I know what, my other OB had told me. So I kind of explained that to him, which was completely wrong. Imagine that. It was very complicated, really, really stupid. But anyways, he said, so your first day that you're bleeding, you start bleeding, that's your day 1. Then you're going to go out to day 12, 14, and 16. Those are your best days of ovulation, best days of intercourse. So we want to have sex on those days. Okay, great. So then on day 21, we're going to have you go and do blood work. Again, great. So on days 12, 14, and 16, I went ahead and had intercourse. And anyone who knows me knows, my husband works shift work. It's not easy to just drop the ball and be like, okay, well, here you go. Let's go have some sex, because it's that time. You're ovulating. It just takes the fun out of it, which is not the best. And it's kind of hard. And that's definitely one of the downfalls of infertility, having to be on a schedule or be on a timer. It's sucks pretty much. But anyway, so we went ahead and did our thing, and then day 21 came around, and I went and got my blood work done. In my blood work, they tested for progesterone, HGC, and one other thing I'm not completely sure. I believe it was my thyroid, but I'm not 100% sure. Regardless, I went and got that done on the 16th of this month, which is January, the month of January. So I got that done on the 16th. My results came back on the 17th, and actually the nurse is the one that called me, not my doctor, but that was okay. She called me and said, all right, it looks like your blood work came back, and unfortunately you're not ovulating at all, which of course no one really wants to hear. I mean, kind of after that, it was kind of like shut down, don't want to listen to anything else, because you're not ovulating at all means you're not going to have a baby on your own. And I mean, there were concerns that it wasn't me, that it was him. And of course we got him tested, but the results haven't come back for that yet, unfortunately. But you never want it to be you. You know, you always want it to be something else, like it was just like a fluke thing maybe, I don't know. Regardless, I wasn't ovulating. So she has told me that I will be put on what is called Clomid, which is an infertility drug that will make me ovulate. There are some side effects to it. Vaginal bleeding, breast tenderness, blurred vision, severe headaches, nausea, vomiting, diarrhea, and severe mood swings. Well, anyone that knows me knows that I'm a pretty big biatch whenever it comes to that time of the month. And I told my husband, hey, like, these are some of the side effects, left that, you know, severe mood swings till the very end. And of course he wasn't very happy about it, because I know that he wants to be patient with me, and it's not the easiest sometimes. But anyway, so pretty much now I'm just kind of waiting to start. That way I can go in, and what they said was, once you start, give us a call. We'll make you a doctor's appointment. We usually get you in pretty quickly, because we are going to put you on the Clomid. And they're going to do another pelvic exam to make sure that I am bleeding, which is kind of weird. I've never had that done before. I'm a little uncomfortable about it, you know, because I will be bleeding. Hopefully it'll be like within the first day, so, you know, my flow won't be very heavy or anything. But they're going to do the pelvic exam to make sure that I am bleeding. And then once they do that, they'll go ahead and prescribe me the Clomid. And the articles that I have read have said that your days that you normally take it the Clomid are on days 3 through 7. So that's 5 days of pills. And again, like I said earlier, I don't like taking pills, so I'm not really looking forward to that, but it's something that I can definitely live with if I want to have a baby. And then another thing that the articles have said is that you also have to have sex on days 11 through 21. Either every day or every other day, which is great because, again, my husband works shift work. We're going to have to really get on that timer there. So at this point, I'm a little nervous. I've done a little bit more research. I did look up and see, I was like, okay, well, how long is this going to take? Because, like, I want to have a baby now. My sister actually just had a baby, so I'm really excited to go and hold her. But anyway, how long is it going to take for me to get pregnant? Or how long could it take, possibly? Most women conceive within the first 3 months, or the first 3 therapies is what they call it. And then there's very few that actually conceive after 6 cycles or 6 months. So those odds are really good. I have read and seen some videos of people who have only had to take the Clomid once, because it is just something that helps you ovulate. So maybe they just needed a kickstart. Maybe I just need a kickstart. I don't know. So pretty much at this point, I'm just waiting to start. I was supposed to start on the 26th of this month, but since I am having irregular periods, I don't know when I'm going to start, so I will have to keep you guys updated on that. I will probably do another video whenever I start, go to the doctor and get, you know, some more answers, or, you know, see what the next steps are. And I'll do some more videos on once I start taking the Clomid, the side effects that I had, and whatnot. Once we get my husband's test results back, I'll share those with you guys. I'm going to try to stay up with this as much as possible. I do work a full-time job, so you guys try to keep me accountable for that, because I'm really bad about remembering things, so that'll be great. But if you have any questions or want to see, you know, a different video, or you want to see more of my experience or whatever, like, share, and subscribe to my channel. Make sure you leave some comments down there so I know that you guys are there. Thanks for watching, and I hope to see you guys soon. Thanks.